Hey, guess what? I'm 4 weeks post-op of my top surgery. So, you wanna know what's really freaking cool? Oh, watch that. Watch that. That is freaking cool. Oh my god, do you not realize how self-conscious I have been for so long having this strap showing? I haven't worn sleeveless shirts comfortably in so long. Like, I don't really have that many. So, when I saw this at the store right before my surgery, I was like, it's not like I'm a big beer drinker or anything, but it caught my eye because I was like, that could be my victory shirt. It feels so good just to have my skin touching the shirt without something in between. I didn't realize how much, I miss that. It's, that's not something you've experienced ever since you were a kid. But yeah, it's great. But you're here to see my results, right? So we'll start with that. Just a fair warning, this was not without complications. So I'll show you the results first, and then I'll talk about the complications. All right, so here's my chest. Overall, I'm like super happy with it. Like I went to Dr. Figgy in University of Nebraska Medical Center. Very knowledgeable, really awesome guy. He's so supportive. Like right before I went in, he just took my hands and went to my eyes, and it was like he was rejoicing with me on this stage of my life. It was so nice of him. It really is a good surgeon to work with. They really care about the patients. All right, so if you can see my incisions, the tape just came off today. I just had my 4-week appointment. So there's probably just a little bit of adhesive stuff, but you can see my incisions are really good, in a good placement. There's a little bit of adhesive left on there I gotta scrub off, but the scars are looking really good, healing really well. Now what I had is a double incision with buttonhole, so I still have nipple sensation, at least on this side. This side, we had a little bit of complication, but we'll get into that in a second. So the nipple itself is still healing on this side. So this isn't exactly what it'll look like, in a month, 2 months, 6 months, a year, but it's really close to probably what it's gonna look like. With it only being 4 weeks, I need to build up my chest again, because I did a lot of chest building and exercises before surgery, but of course, not being able to use my arms for so long, I've lost a lot of muscle on my shoulders, my arms, my chest, abs. I had abs, arm. It all just woof, and the muscles just woof, and it's like, I hear muscle memory. The muscles will build back as soon as I'm able to start lifting weights without compromising anything. They said if it's 6 weeks, the scars are 80%, strength. So technically at 6 weeks, I should be able to start lifting again. But we'll see how everything feels at 6 weeks. I might put it off another couple weeks if I still have a little bit of pain, complications. Let's get into that. So, first of all, the surgery went really well. I haven't heard of anything weird happening. And they were nice, they explained everything beforehand, the process of me going under. They told me that they'll give me something to relax through the IV. I'm like, all right. So I'm thinking, okay, they're gonna sedate me a little bit, and I'll see the mask over my face, and then I'll go out, right? That is that's how the movies are, right? That's what I was expecting. Well, you're wheeling me down after they put whatever they put in the IV, and they stopped at the door. Just kind of look at me, like they were waiting. I'm like, what? What are they waiting for? And then she's like, oh, there he goes. And then nothing. And then I woke up. It was the weirdest little time shift. I've never been put under before, so it was just blacked out. Those 2 hours are just gone. Didn't exist anymore. It was just a weird experience. So after surgery, they give you at least for me, they give you something to keep you numb for another couple days. So the first couple of days, it really didn't hurt, especially when they had me. Also, they prescribed me some oxycodone, which I'm really grateful for because it really, when you have a major operation like that, it really does help. So with the prescriptions plus the injection, I didn't feel that much, right? And third day, starting to feel things, whatever. But okay, my post-op instructions are different than a lot of people's, including people that are local, because they wanted me to bathe. Yeah, after 3 days, I wasn't really quite sure I understood the instructions correctly. So at the third day, they wanted me to take off the bandages, redo the dressing, and then and bathe. But I told them I had sponge bath because I wasn't sure that I was actually supposed to bathe with drains in and stuff. They did. They made it clear. Yes, don't want infection. So that's how they want me to prevent infection. I was like, okay, cool. The thing is, when I took the bandages off, my heart kind of leaped a little bit because this side looked great. This side was black. Like, the nipple was dark and there's like black liquid around it under the dressing. And I was like, that doesn't really look right. But maybe it's okay. Anyway, a couple days later, I was like, finally messaged them because it didn't look any different. And I was getting concerned that it was like blood. And I was like, messaged them and I was like, this is what's going on. Here's a picture. Here's a picture of my chest. What do you think? They said that it was probably dark because of the medicine that they put on after the surgery. So I'm like, all right, fine. So that was the first week post-op. That Sunday comes and I'm not just sore. I'm like starting to feel fire in the corner of my chest. I'm like, okay, what's up? What's going on? And I'm thinking, a lot of guys on here, they don't talk about complications. But I have seen a couple videos on them. So I was like, fuck. I wonder if it's hematoma. But it's not getting that big. It wasn't that big. But it was pain. It was a lot more pain on this side than that side. Anyway, I had an appointment that Tuesday to get the drains out. At that Tuesday, that would be 12 days post-op. So I went in that Tuesday. And I was like, this is what's going on. Look at this nipple. And hurts. And they were like, oh, you have a little hematoma. They tried to drain it. Couldn't drain it. Couldn't get anything out. They took my drains out, which felt a lot better because the drains suck. They get really uncomfortable. Yeah, they were like, yeah, it's a little hematoma. There's nothing's coming out. So it's probably solidified already. But, if that's the only complication, we're doing pretty good. They said that the nipple at this point had scabbed over. And she let me know that, even if I had come in when I first messaged her the week before, there's nothing they would have done. Except, continue to dress it and stuff. Because she said it's not infected. The nipple had been compromised. So I'll show you a picture what the nipple looks like with the scab on. The way you don't freak out, they don't have to surgically remove it. So that they just let it heal. That's their protocol. So I'm like, all right. So I was just waiting for the scab falls off. I started being concerned, like, okay, what's it gonna look like under there? Like, is there gonna be a crater? Whatever happens, it happens, There's nothing I can do to change it. Tell you what, at that point, with the hematoma coming, my nipple failure, I'm like, why the hell me, man? Oh my god. Why me? Why can't I just have like a normal surgery outcome? Like, so many freaking people. Why? And I was like, I know I can't. I gotta stop comparing myself. I gotta stop comparing myself. My story is not everybody else's story. So I just gotta let go. This is just part of it. So I'm like, okay. So, a couple days later, after that appointment, or like the day later, hematoma was getting worse. It was on fire. The next day, I was like, I was out of oxycodone because they only prescribed me a little bit. And I begged for more because absolutely no over-the-counter stuff was working. They were such good people that they, agreed that that was the best thing to do. And so they prescribed me some more, and so it was still hurt even through the oxycodone. That's how bad the pain was. Like, literally, the only thing more painful than having a hematoma was literally 12 years ago when I had my son with no epidural. That's the only thing that was more than this. This hurts so bad. So finally, I tried to tough it through, and finally on Friday, I'm just like, you know what? I gotta go in. I gotta see if there's anything that they can do. I couldn't take it anymore. So I went in. I tried again to drain it. This time the surgeon did it. He jabbed hard. Oh god, that hurt. He got like that much out. But what I think happened is I think he popped it or something. He said it probably jellified. He agreed that it jellified. And he didn't, but I think he might have popped a pocket or something because by the next day I felt like a lot better. And by the end of the weekend, it was back down to this size, which you can see. This side is like it's right in here. It's a little bigger than this side, but it's not that much bigger now. So my guess is he popped in of extra fluid when was reabsorbed by my body. That's what I think happened. So I feel a lot better. I felt a lot better. My nipple. Scabbed over, right? Alright, so today, after they took the tape off, she got the scab off. So I'm going to show you, in case this ever happens to you, you don't have to freak out. Just be straight up with your surgeon about what's going on. I'm sure all surgeons have different protocols. This is my surgeon's protocol. So we have the antibacterial dressing on it. I'm going to show you what it looks like. It's kind of funky. Alright, no scab. So the nipple, here, I'll show you, I'll go up front closer. Alright, so the nipple kind of looks really funky. There's like a hole up here. I don't know if you can tell from... Yeah, it looks a little weird. Yeah, there's like a little hole right there. It's definitely not going to be symmetrical. She said today, mentioned nipple reconstruction, which I'll consider, but my thought is, as long as it's doesn't look too bad, my thought is I'll just get a big ass tattoo right here or something, maybe a pheasant or something, that'd be cool. And then just get a big ass tattoo, so that way the asymmetry is not very noticeable. Y'all that haven't had top surgery or don't know much about it, so this is not what it's gonna this is not the final version of the chest. Like, it's gonna fill out, pecs will fill out, especially as I get back into working out. Scars will fade over time. So it's a lot more flatter right now. Like, there will be more muscle, pretty, and it'll build up pretty fast, I think. But I am super happy with the shape he gave me. Looks, yeah, really, it looks really good. I'm really happy. There's like no bulges of skin, like sometimes there's like a pinch of skin where the incision is on the sides, but he did a good job. It's gonna probably heal up totally smooth on the sides. He did good. Only ways it goes up. So I'm looking forward to working out again, because you see my arms, they are scrawny. Look at what happened to me over a month, just a month of not doing work, not able to use my arms, period. Like, you have to do the Tyrannosaurus Rex thing. Like, my range of motion is a little bit better now. I'm still really careful because I don't want to scratch the scars. I'm more daring about what I pick up. Just no, too much weight will fuck me up. I don't need to do any more fucking myself up, right? I just want it to heal. So I'm gonna take my time. I'm cleared to start running, so I'll at least be able to do something. But I've lost a lot of muscle in my shoulders, my chest, my abs, my arms, pretty much everything. And that part's a little weird, because I didn't expect it to go that fast, but it kind of makes sense, because I literally couldn't use my arms. Even like those times where I work out like 2 months and then fall off for a few weeks and go back to working out for a couple months and have that cycle. And when I'm falling off those couple weeks because of life or whatever, I'm still being physical because that's my life. I lift up 50 to 100 pound dogs, put them in the grooming tub or on the grooming table every day. Or, even like grooming small dogs, you're using your arms the whole time. And this has been nothing. It was really weird. Like, I could feel my muscles screaming at me the first few days, like, what are you doing? We need to move. And I'm like, I can't. But it's almost better. I'm getting it back. I'll give you guys updates. And I'll talk to you guys later. Thanks for watching.